Hey, folks, I'm just so happy that you're here today. I hope everybody's having a great day. And again, I want to appreciate you and tell you how much I do appreciate your time that you take to be with me because I know everybody's really busy. And it's just nice to get kudos every now and then. So kudos to all of you for listening because I try to, whenever I put a show together, I always have a goal. And my goal is that you walk away from the show going, I learned so much that I can use in my life to help make myself better. So that's what we're going to try to talk about today. Today, low back pain. And we're going to cover a lot of low back pain issues that you never thought about and how your diet can be affecting low back pain, but not how you think. You're thinking, well, I eat food and it causes inflammation. No. There's a lot more complicated pathways that we have to discuss than just that. So we're going to talk about diet and low back pain and why a lot of you who have low back pain are making the problem worse. You know, I've been a chiropractor now I've been in practice now over 32 years. And people come to me all day, every day, with low back pain and neck pain and shoulder pain and headaches and the traditional chiropractic things. But a lot of people come to us, too, for digestive problems, nutritional advice. And so when you come in our offices, we try to get the nervous system working, the digestive system working, and good nutrition. We try to put the whole package together for you. Because chiropractic is amazing. I mean, without chiropractic, I'm sure I wouldn't even be here right now. I had such bad spinal injuries when I was a kid. And chiropractic has me functioning at an amazing level, so that's great, but what else can we do? Well, you want to have chiropractic, put the bones back in place, but your diet makes the nerves work. So if you have a pinched nerve, that's one thing, but if you don't have the right chemistry to make the nerves work, that's another thing, and then you have to have good digestion. So we'll kind of cover low back pain a little bit here, and we've got a lot more to cover too. But low back pain has become one of the biggest problems in the public health care system in the past 50 years. Now, it's interesting. I was just talking to one of my colleagues here, and we're talking politics because I am on radio, so we have to talk about politics somewhere. And everyone's discussing the health care plans and how we're going to get rid of Obamacare and we have to replace Obamacare. And Trump's plan is going to have this many people without insurance. And then the argument is that a lot of people are not going to have insurance because they choose not to. They'll be uninsured, but they were forced to have it under Obamacare, and now they're going to say, listen, I don't want to have insurance. So you're considering those people as uninsured. Anyway, the political argument went on and on and on. But that's not what I'm concerned about. What I'm concerned about is nobody is discussing health care. What are they discussing? Insurance. It's a big difference. They keep discussing health care. That alone is a lie. I don't care which side of the fence you're on, left or right, red or blue. No one's discussing health care. They're discussing insurance. And all my doctors, I know a lot of doctors, and I have a list of doctors I refer to, chiropractors, medical doctors, surgeons, acupuncturists, psychiatrists, because I would love to say I can fix everything you have. I can't. But I can certainly tell you where to go when you need something fixed. And we work together. All my doctors worked with me as a team. Every doctor I talk to, doesn't matter what the profession is, I joked, we used to talk about girls in sports, and now we talk about retirement. How are we going to get out? What's our exit plan? Every doctor. So doctors are not happy doing what they're doing because of what's happening with insurance. So doctors are saying, what else can I do? And so I want you to consider this, that we are in the midst and getting worse of a doctor shortage and a healthcare crisis. It is a healthcare crisis because doctors are not wanting to be doctors anymore. A lot of them. I still love doing what I do, of course. But a lot of doctors want to get out. And I don't know if I want to go to a doctor whose main plan is how do I get out of this thing. I want somebody who's excited about going to work. So you now have to take responsibility for your own health. I know that's a big word. It's the R word, responsibility. So I want you to start thinking, what can you do to take control of your own health so you don't have to rely on a government plan or a subsidy, because that might not be there. I want you to think, what happens if I don't have insurance coverage? I don't care what your political philosophy is. I teach my staff this. I teach my staff that whenever you look at a file, assume everything in the file is wrong until proven otherwise. And I like to live my life that way. Assume everything's wrong until proven otherwise. Pessimistic? Nah, I think realistic. Because when I look at a patient, I say, okay, what's wrong? Okay, well, they don't have this, they don't have this, they don't have this. What do we have left? Well, we have this, this, and this. Let's focus on it. And it's kind of a neat way to live your life because then you don't set yourself up for failure. So I want you to think about that. I don't want you setting yourself up for failure when it comes to health care. So back pain, big issue. How many people have back pain, by the way? Raise your hands. I can't see you, by the way, folks. I'm on a radio, so don't really raise your hands. Not a lot of you. A lot of you have back pain. A lot of you can't lift your shoulder because it hurts too much. But a lifetime of low back pain is reported in as high as 84% of the people at some point in their life. Chronic low back pain is present in 1 in 5, and 1 in 10 is disabled from back pain. That's a big epidemic. If 1 in 10 people ate a certain food and got sick, we would be, oh my gosh, we must do something about this food. We can't be eating this food. We have to have better controls over this food. That's what's happening with back pain. 1 out of 10 people disabled. Number one reason people miss work. What do you think it is? Common cold. What do you think number 2 is? Back pain. So we have an epidemic, folks. And I'm going to teach you the things that you're doing that are making it worse. Uh-oh. Going to have to take responsibility again. And is it just lifting? Is it bending? Is it golf? Number 1 sports injury I see in my practice is golf. Mechanical factors, lifting, carrying, they play a big role in it. But there's other things that are related as well. Arteriosclerosis, hardening of the arteries, and I see this a lot on my patients, folks. Arteriosclerosis can obstruct arteries that feed the spine. This can diminish blood flow, and that can cause back problems. So you're eating your typical American diet: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. I just read your menu, didn't I? I walked in the studio today, one of my coworkers said, "Hey, Dr. Joe, we got donuts in the room over there if you want some." Everybody picks on me. What's the matter for these people, eh? And so you're causing a lot of the pain because you're eating donuts or you're eating bad food or smoking cigarettes. And what happens is you have cholesterol floating around in your blood. Now, the cholesterol is released by your liver, and it goes out to do things. It builds hormones. Every cell wall has fat in it, like cholesterol. And it does its thing. What's ever left over gets recycled, goes back into the liver. It gets broken down and passed out. And then your body produces more cholesterol. And that's kind of how the cholesterol cycle works. Well, new research is showing that people with high cholesterol oftentimes don't have too much cholesterol. They're just not recycling their cholesterol properly because the liver, the recycling channels, are all clogged up. So how do we lower our cholesterol? A, we can stop producing so much, which may not be good because you need cholesterol. Or B, what if we just clean out the recycling bin? And that seems to be the thing that works so well to help lower cholesterol. But that's not what I'm talking about today. When you have a bad diet, and the diet's high in things like alcohol, meat, and sugar, and dairy, and coffee, and soda, and artificial sweetener, what I call the 7 deadly sins of nutrition, when your body acts on these bad foods, these foods are acidic, and they actually irritate your artery walls. And you irritate the artery walls, the body lays down this circulating cholesterol. It lays down the cholesterol to kind of act like a scab over this scratch that was caused by bad chemicals in the blood. And so now we start to make the artery wall a little thinner because we're clogging it up a little bit with cholesterol. It's like clogging up a pipe. And if you clog up the pipe a little bit, the water still flows and it's no big thing. But over the years, you keep eating a bad diet, you keep irritating the artery walls, you cause inflammation, body lays down cholesterol. Eventually you get hardening of the arteries. And now the plaque itself is not really hard. It's actually the consistency of toothpaste. So you're probably thinking, oh, it's hard like concrete. No, it's consistency of toothpaste. But the more layers of this cholesterol you lay down because you keep irritating the artery walls, now you start blocking off the blood flow. And if that goes to the sex organs, well, it has an effect on that. If it goes to the brain, it has an effect on that. But if we start clogging up the blood vessels that supply the nerves that come out of the low back, the neck, the mid-back, wherever, now those nerves are not going to be working properly. And that can cause pain. So the typical American diet, the Western diet, is causing a lot of problems. We can take MRIs now. This is something we didn't have, of course, many, many years ago. But we can take an MRI, and it can show the occlusion of the spinal artery in people with back pain and degenerative disc disease. Now, I'm going to talk about degenerative disc disease as well, because, again, I'm a chiropractor. I got to address this. Researchers show that patients with long-term low back pain have constricted blood flow, and those with high cholesterol appear to suffer with more severe symptoms. Those with narrowed arteries appear about 8.5 times more likely to suffer chronic back pain. So you're eating your typical American diet. You see that you follow the pathway now, right? You irritate the arteries, body lays down cholesterol, narrows the arteries, cuts off the blood supply, increasing your risk of pain. The discs in our low back are the largest avascular tissues in the body. Now, avascular means without vascularity, without blood flow. So your discs, the discs are little cushions. So you imagine you have your bone, your vertebrae in your spine, and then you have a cushion in it called a disc, and then you have a vertebrae and a disc and a vertebrae and a disc. Now, the reason the discs are important is they act as a shock absorber, but they also keep the vertebrae away from each other. They're little spacers. So as the vertebrae open up with this spacer in the middle, it allows an exit, what's called a foramen, for the nerve to exit the spine and go out to the body. As a chiropractor, this is where I live and breathe. So if that foramen is wide open and there's no pressure on the nerve, we're in good shape. But because the discs are avascular, they don't have very good circulation, and the older we get, the worse it gets. If the discs are not getting circulation from around there, they kind of just they suck nutrition in from the arteries around it. The discs now start to wear out. Nutrition just kind of diffuses into the disc because, it doesn't have its own circulatory system very, very well defined, making it especially vulnerable to deprivation. So if you don't have good blood supply around the discs because you clogged up the arteries and you're not eating good foods, now the discs become real vulnerable. The discs degenerate far earlier than other musculoskeletal tissues. There are new findings out that lumbar spines start to degenerate as early as 11 years old. Nearly all kids have the beginning of arteriosclerosis by age 10. Let me say that statement again. Nearly all children in the United States have some hardening of the arteries by age 10. That's some scary stuff. So now we're cutting off the supply around the disc. The disc is not getting the proper fluids and the proper nutrition, and it starts to dry out essentially. So that's pretty scary stuff. By the early teen years, we already see discs starting to deteriorate. By 49 years old, 97% of discs of those eating the standard American diet show at least grade 2 degeneration. It's 4 grades, so you're halfway there. Like the Bon Jovi song, we're halfway there. So your disc is already halfway degenerated by 49 years old in 97% of the people in this country. Now, as a chiropractor, hey, that's great for me. That's how I make my living. But it's not great for you, and I don't want you to be one of those people. I've got plenty of patients, folks. I want you, the listeners, to be healthy. And then we're going to bring in new listeners, and they'll get healthy. I would love to have taught everyone how to get well. Like I said, when it comes to health care, we're not talking about health care when it comes to politics. We're talking about insurance. We need to be talking about health care. And that's where the big gap is. And if people get better, I've got the answer. If people take control of their own health, get their spines fixed, get their diet straightened out, get their digestive system working, we're not going to be spending a fraction. We will be spending a fraction of what we're spending now on health care, and there's going to be plenty of money to go around. And guess who's going to benefit the most? You. You, the patient, is going to benefit the most because now you have a plan to take care of yourself. Cholesterol plaques form around the walls of the aorta, and that can be a big issue. Now, as a chiropractor, we take x-rays on our patients most times. I want to see what I'm dealing with. And every day, I can't think of a day that goes by that we don't see at least one, usually several patients, where we start to see plaquing of the aorta or the common iliac arteries. We can see it on the x-rays. Now, if we can see it on the x-rays, that's bad. It's already in its advanced stages. So when patients come in our offices, we want to get their spine lined up. We want to get help with the back pain, their leg pain. But I also want to straighten out their diet so we can improve circulation so that the discs start to heal a little bit, the spinal nerves start to heal, and you get better results. My goal is to get you the best results possible, but you have to help me. So if you're eating a typical American diet, clogging up your arteries, and I see it on an x-ray, that's not good. Most people, wow, Dr. Joe, that's serious and I need to listen to you. I said, yeah, you do. Some people don't. The ones that don't inevitably end up back in my office months, maybe years later, and they always say the same thing. You weren't kidding, were you? No, I wasn't. My spine got a lot worse. Yeah, it did. What do we do now? Well, now it's going to cost you more money, you, the patient. It's going to cost me more time. And there may be some things that aren't fixable at this point. So stop wasting time. Stop thinking I have tomorrow, tomorrow, tomorrow. You don't. You've got to start taking control of your health care now, today. And if you don't, this is another thing you have to worry about, is an increase in your pain. So, folks, if you'd like to come see us in our offices, we have offices in Marietta, Duluth, and Stockbridge. We would love to have the opportunity to meet with you and see if we're a good fit, if my team of doctors and you are a good fit as a doctor and patient, because we like to have a good fit on both sides. So if you'd like to make an appointment to come see us, go to my website, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world, and we'll set you up a time to come see us. We accept most major, in fact, we work with everyone. People always say, do you accept my insurance? Just talking to a producer of another show here, another nationally syndicated show. And he was saying that, too, that even though people have insurance, they have $5,000, $6,000 deductibles, they have these co-pays that are outrageous. So whether you have insurance or not, chances are that you're going to be paying something out of pocket anyway. And so we're more than happy to work with you, insurance or not. We accept most major medical insurance. So we accept Medicare. Car accidents. Hey, folks, if you've ever been in a car accident and a car was damaged, you were damaged 100% of the time. And we need to get that fixed. So if the car was damaged, you have to come see us. I'm going to make you. I don't know how I'm going to do that, but I'm going to figure it out. Because if the car was damaged, you have damage to your spine. The longer you wait, degeneration of the discs, circulatory issues, pinched nerves, it just gets worse and worse. So go to my website, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world, and we will set you up a time to come see us. I really want to get you well, but stop wasting time, folks. Don't be like so many of my patients that say, why didn't I do this sooner? Because that's the biggest complaint I get in my offices. So we're talking today about low back pain and how it's related to your diet, not just low back pain, but all back pain. So structures around the disc, the circulation around the discs has to be good. And you have to have the right nutrition circulating in the blood vessels to diffuse itself into the discs. They start to degenerate. And as they degenerate, they can burst open. And if they burst open, it's called a herniation or a herniated disc. Now, there's two types of herniated disc, protrusion and prolapse. God, there's a lot of big words here today. Protrusion means the disc is swollen. Prolapse means the disc is burst open. Protruding discs can push against the nerve and cause pain. And we treat a lot of those in our offices. Patients come to us all the time. Doc, I had an MRI. I went to my orthopedist, my neurologist. They're stumped. They don't think it's a surgical case. Many of them said, go see Dr. Joe. They come in, I look at their MRI, sure enough, there's a bulging disc. And we've got to open up those disc spaces, pull apart those vertebrae very gently, and try to suck in that bulging disc, kind of like a bubble in a tire. And in most cases, it's very successful. If it ruptures, it depends the way it ruptures. Sometimes it ruptures away from the nerves. You don't have a lot of pain. Sometimes if a piece of it breaks off and hits the nerve, that's when it's a real serious case. And in cases like that, and those are very few that get that bad, I may have to send you out to a surgeon. I like to send you out to a neurosurgeon for the spine, orthopedic surgeon for extremities. And we have a great list of doctors I work with, both neuro and ortho surgeons. So you don't want your discs to get that weak that they actually burst open. Because if they do, you're going to be in deep doo-doo, as we say. So there's a link not only between clogged arteries and disc degeneration, but between clogged arteries and disc herniation. So again, degeneration means it wears out. Herniation means it bursts open. So a compromised blood flow can also damage the nerve roots that come off the spine, which can be linked to things like sciatica. Sciatica is shooting pain down the back of your leg, into your butt and down your leg. Anybody ever have it? Anybody have it now? I had it for years. When I was a kid, I played football, I played hockey, got in street fights, got hit by a car when I was 10 years old. They thought I was dead. I was in Germany at the time. They covered me up with a sheet and said, he's dead, leave him there. And hours later, this is way before cell phones. I was in between towns. By the time they finally got an ambulance to me, as they would put me in the ambulance, I moved. And they said, oh, I guess he's not dead. But I landed on my head. I caused all sorts of spinal damage. So when you talk about spinal damage, I'm the expert on this. I got this one handled here. And so probably what led me into chiropractic is I wanted to fix myself. I had pain so bad down my leg when I played football and hockey. I remember after a game, I would hold my left leg up to my chest, and tears would be coming down my face. And I seriously, this is not a joke, I seriously thought there's got to be a way to cut this leg off. How can I personally cut my own leg off? The pain was so bad. Now, this is before I knew about chiropractic. Finally, at 18 years old, I finally went to a chiropractor. And I saw a coupon in a newspaper, free exam. I said, okay, I'll go do that. And the guy checked me out, took an x-ray. He says, you have a fracture in your low back. Do you know that? No, I didn't know that. Now, when it happened, I don't even know, but the pain had been there my whole life that I can remember. And so we worked, and still to this day, I get adjusted and put the bones back in place, stabilized the spine, and my sciatic pain went away. So my sciatic pain was due to a pinched nerve. Yours can be due to a pinched nerve and can be complicated by clogged arteries. So when you have that pain down your leg, numbness, weakness, that can lead to a lot of disability. Sciatica affects about 1 in 20 people. Clinical sciatica may be associated with blood cholesterol levels as well. So it could be a pinched nerve, could be blocked blood vessels, probably is both. In many cases, it's both. I shouldn't say that. The nerve roots, which are commonly associated with sciatica, also supply some of the arteries that now can be clogged. So it's interesting that the blood supply supplies the nerves, and the nerves give the nerve supply to the blood supply. So they need each other. And so if you're not getting the proper blood supply because of clogged arteries, the nerve isn't working, the nerve can't control the arteries properly. And now you're caught in this little cycle. Did you follow all that? Little complicated there. So obliteration of these arteries by cholesterol buildup results in compromise of nutrition supply to the nerve itself. Lack of oxygen to the nerve can play a role in sciatic, and that can cause you to cry out in pain. So you're not getting blood supply, you're not getting oxygen, the nerve isn't working. The other thing that nobody ever talks about, which is why you listen to these shows, is those same nerves, that sciatic nerve, or the nerves that control your low back, also control your colon, sex organs, and bladder. So if you have low back pain, you might also see things like gas, bloating, diarrhea, constipation, urinary problems, sexual problems. These are the nerves that control everything from the waist down. Now, you probably felt like I just read your diary. Wait a minute. He said low back pain and gas and bloating, diarrhea, constipation, urinary, and sexual problems. Hey, wait a minute. That's me. Raise your hand if that's you. I bet it is. Because that's how the nerves work. People say, how did you know that, Dr. Joe? It's easy. This nerve controls this. This nerve controls this. You're not surprised when an electrician says, well, this wire controls that light, because that's an electrician's job. As a chiropractor, my job is to find where the pinched nerves are and what organs are being affected. The first thoracic, right below the base of your neck, the first thoracic, that can affect the heart and lungs. The eighth thoracic can affect your liver. Sixth thoracic controls your pancreas. First lumbar, 12th thoracic controls your kidneys, your adrenal glands. And so now you start having problems with the organs. The problem may not be the organ, it may be the nerve supply to the organ. I've had patients that constant urination, and we adjust the nerve supply to their kidneys, and the next day the urination is better. Oh my gosh, Doc, how did you know that? I didn't. I just knew I put the bones back in place, and the body took it on and healed it from there. I probably knew it would work. So I want you to consider when it comes to your health care that it may not be the organ malfunctioning, or that organ malfunctioning may be caused or aggravated by the nerve going to it. So this is a different spin on healthcare. That's why so many of my patients, our patients, I have a team of 7 doctors, are nurses, are physicians, work in hospitals, because they hear what we talk about and they say, I've never thought about it like that before, but you're right, Doc. I have neck pain and my thyroid isn't working properly. Well, the 4th and 5th cervical nerve could be affecting the thyroid. And when you put it together like that, it's light bulbs suddenly come on in patients' heads and they go, that makes sense. Ever since I hurt my low back, I've had bowel problems. And then we get the diet straightened out, clean out those arteries. And if you have acid reflux or heartburn, many times we have to adjust or pull the stomach down away from the diaphragm to fix that as well. So much of healthcare is physical, not chemical. So folks, if you'd like to come see us and get your physical checked out and your chemical, go to my website, drjoeesposito.com, or just Google Dr. Joe with the #1 Dr. Joe in the world, and we'll set you up a time to come see us. Now, we accept most major medical insurances, even with high deductibles. We work with those patients as well because a lot of you have those high deductibles. We'll make it work for you. If you're serious, there's a way you'll find a way to get to see us. So go to my website, make an appointment, and car accidents. Let me cover car accidents again. If you've ever been in a car accident and the car was damaged, you were damaged 100% of the time. So you definitely want to get that fixed. I don't care if the accident was yesterday or if it was 50 years ago. If you never got it fixed, you need to get it fixed. Take care of your body, folks. So many of you are suffering needlessly. And I don't want you to be like so many of my patients that say, why didn't I do this sooner? So right now, go to my website. You can make an appointment right online or give us a call from the website, drjoeesposito.com, or just Google Dr. Joe. And the website has a lot more information than that on it as well. Hey, got to go to a break. Do me a favor. Tell your friends about the show. We'll be right back. Hey, folks, thanks for taking time to be with me today. I do appreciate that. We're talking today about low back pain, actually all back pain, not just low back pain, and how that's related to your diet. And what's interesting is you would think, well, if I eat bad food, it's going to cause inflammation. It's more than that, because if you're eating a bad diet, you can irritate your artery walls if you have too much acid in your diet. And when the artery walls get irritated, it essentially scratches, for lack of a better word, the inside of the artery walls. It causes an inflammatory reaction. The acid irritates it. And what happens then is the body lays down cholesterol as almost like a scab to fill in the irritated, inflamed areas. And the more irritation you have, the more inflammation you have, the more cholesterol is laid down, and the narrower your arteries get. And now you're cutting off the blood supply to the nerve supply. The nerves don't get enough oxygen, and they start hurting. So as a chiropractor, I'm always looking to see what's causing the back pain. Is it a bone out of place pinching a nerve? The answer is usually yes. And so my team of doctors and I, we work to get the bones back in place. But then we also have to look at, what are you doing to slow down the healing process? So I need you to take some responsibility for your health care as well when you become a patient, or if you're not a patient. I know this show is heard all over the world, so some of you, it's not practical to become patients. But you need to take responsibility, because you might be causing a lot of the problems. And if you cut off the blood supply to a nerve and the nerve starts hurting, that's a problem. But it's not just the pain. The thing that nobody talks about, except it seems like the chiropractic community, is that those nerves also control organs. So if I have a bad diet and I'm clogging up my arteries and I'm not getting the oxygen to my nerves are not functioning because they're not getting enough oxygen, that means that nerve is controlling something, my liver, spleen, kidneys, gallbladder, reproductive organs, eyeballs, earwax, whatever it is. And now that part of the body can't work properly. So there's a physical component that we need to address when it comes to pain. Are there pinched nerves? And there's a chemical component that needs to be addressed. And nobody seems to be addressing that either. I know there's a big buzz about aesthetics now, and you have these machines that can either freeze some of your fat cells or melt some of your fat cells. What a great idea. If I could freeze or melt my fat cells in a certain area, I can sculpt my body, and I can get a flatter stomach, get rid of my love handles. That's, my little baggy arms under the chin. That's amazing stuff that we have. It's almost replacing liposuction. This is the new trend, which is pretty cool. But my concern then is, you think, all right, well, I just, lost an inch off my waist. That's pretty cool. I'm going to go celebrate and have ice cream. Well, now we eat bad foods. And if I don't have fat cells, because they were destroyed, let's say, in my abdomen, they have to be deposited somewhere else. So as the trends in healthcare change, and this is a cool trend, I think you also have to add that the patient takes responsibility for their own health. So this is where no matter what trend we're looking at, whether it's aesthetics or if it's pain or if it's weight loss or if it's cholesterol, diabetes, heart attack, osteoporosis, you need to take control of your own health. Now, lack of oxygen to the nerve can play a role in sciatic pain or any type of pain. Reduced blood flow also hampers the removal of waste products, because the blood not only brings nutrients into the area, flushes out waste products. Things like lactic acid can irritate the nerve endings, and that can cause pain. So you have to start thinking about that too. Now, lactic acid can build up if I work a muscle too hard. I go work out. Lactic acid is a waste product, and I have good circulation, and the body flushes it out, and I'm happy. There's also uric acid. Uric acid can get into my muscles and cause the muscles to spasm, can get into the nerves and irritate the nerves. And if a muscle spasms, that can cut off the blood supply to the nerve, which can cause the nerve to hurt as well. So uric acid, first thing you think about is what? What disease? Gout, right? Yeah, everybody thinks about gout. However, where do we get uric acid from? Well, meat is one of them. You definitely want to go on a no-meat diet or no animal product diet if you have a gout buildup. But uric acid can also be formed from high fructose corn syrup. Your body takes fructose and converts it into glucose and glucose is the usable form of energy that we use as humans. So I eat regular plain old table sugar, 50% glucose, 50% fructose. That's what a table sugar is made of. Glucose gets used as fuel, yay. The fructose has to be converted into glucose in the liver, and in the process, one of the waste products is called uric acid. Uric acid gets into my blood and my joints, and it hurts. Uric acid prevents the body from producing nitric oxide. Nitric oxide is a vasodilator. Vaso means vessel. It opens up my blood vessels. So now I'm eating soda, or almost everything has high fructose corn syrup in it now, with about 55% fructose, 45% glucose. That's what high fructose corn syrup is made out of. That fructose converts into uric acid, gets in my joints, and it hurts. Uric acid prevents nitric oxide production, cutting off the blood supply to the nerves, which makes the nerves hurt even more. So you chronic pain patients, you fibromyalgia patients, you chronic headache patients, I want you to think about that. And I want you to stop putting fructose into your body. And in severe cases, I even take my patients off fruit, because the fructose has to be converted into glucose. And if you're cutting off the blood supply, now you've got a problem. So my team of doctors and I can give you the best chiropractic care in the world. And you'd say, oh my gosh, you guys are miracle workers. This is unbelievable. I love coming to see you guys. You're so smart and so wonderful. And girls. We're 50% guys, 50% girls, by the way. Somebody asked me that the other day, one of my patients. How come you have any women doctors? I said, half my doctors are women. Oh, I always see you. I said, yeah, well, I'm a guy. You could see the girl doctors if you want. Anyway, I digress. So we got to get you fixed and working properly. Because if we give you the best care in the world, and you're doing things like high fructose corn syrup, or agave nectar, which is 85% fructose, even way worse than high fructose corn syrup, or artificial sweeteners, which are vasoconstrictors, or you're eating a lot of meat, creating uric acid, preventing nitric oxide production, you're not going to get the results that you want. So you have control over the chemical portion. We will take control of the physical portion of your health care. And now we have a team. And so if you want to get the results that you want, how about you, I don't know, listen to us? Give it a shot. I tell people this. Let me own you for 60 days. On the average. Some people more, some people less. On average, 60 days. Let me own your case for 60 days. Do everything I say. Everything my team of doctors say. And if we're wrong, so what? We're wrong. But if we're right, which we are, you'll say what every patient says most people say in our office. Why didn't I do this sooner? Why did I wait so long? And when you change your diet, I can't give up my food, doc. I love my alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Do you love your headaches? Do you love your back pain, your neck pain, your shoulder pain, your bloating, your gas, your diarrhea, your constipation, your lack of romantic function, your high blood pressure, your diabetes, your high cholesterol? You love that too? No. Okay, so why don't you try it my way and see what happens? And then you decide what direction you want to go in. How about that? This way you have options. I always joke. What do girls love? Options. What do patients love? Options. So why don't you give yourself the options? You don't even know what's out there because you never tried it. When you try it, I think you'll be I know you'll be very, very pleased. Low back pain is so common now in children, adolescents. When I first got in practice 32 years ago, I very seldom saw children for pain. Now, we saw children for ear infections and asthma and digestive problems and for other things, health, but not so much for back pain. And now we're seeing it literally every day. Children today are getting disorders that are really adult diseases. Things like adult onset diabetes, high cholesterol, obesity. This is coming in the past couple of years from the way we've changed the way our food supply is made. There was a time before the 1980s where we didn't use a lot of steroids, hormones, chemicals, pesticides, herbicides, genetically modified foods, and now we do. And so the food supply today is different than it was 30 years ago, 40 years ago. And so you have to address that if you want to get well. If you don't want to get well, that's fine. You don't need to address it. But I think it's important that you address it because this is your life we're talking about. This isn't dress rehearsal, folks. One shot. You go around once. And I've been very sick and I've been very healthy. Believe me, I'd much rather be healthy. Now, will you miss a certain portion of your life will you miss, I don't know, for me it was meatball sandwiches and double beef cheese hamburgers. Will you miss that? You might. Is it worth it? Oh, yeah, it's worth it. Absolutely. If you knew what I knew, you would do what I do. If you knew what I knew, you would do what I do. I promise you. Because you would say, wow, wait a minute. So pinched nerves can cause pain. If I put the bones back in place, that helps. And the nerves also control organs, so now my organs work better. And if I put good food in my body, I have more energy and I live longer and I lose weight and my love life improves and my home life improves and I work better and I don't look old. People peg me for about 15 years younger than I am, and I like that. Girls look at me and say, oh, you're in your 40s, right? Early 40s. And I'm like, yep, absolutely. No, I don't. I just smile. I don't lie. I just smile. So if you want to look younger and feel better and live longer and have more energy and save a ton of money, not even little money, a ton of money, try doing what I recommend. And again, if I'm wrong, so what? Patients come to me sometimes and I'll recommend supplements. Like I recommend, there's 2 supplements I take every single day. I take actually several, but I take Super Greens and Essential Source. Dr. Joe's Super Greens and Dr. Joe's Essential Source. Now, if you're not taking them, I think you should. Because they're 2 powders. I mix it. I use coconut milk or almond milk because I don't do animal products. And it's amazing. If I skip a day, I know I skipped it. And so you can get them on my website, drjoeesposito.com, relatively inexpensive. And the Essential Source, for example, is about 10 servings of raw fruits and vegetables, equivalent. Then we had prebiotics, probiotics, digestive enzymes, a complete multivitamin. The Super Greens alkalizes your system, gives you omega-3 fatty acids. I formulated these supplements to give you the minimum requirements that you need to function. So if you're not willing to do anything else, at least give your body some nutrients and see what it does. It'll be so happy. Your body will be thanking you. And you can get those on my website, drjoeesposito.com. Relatively inexpensive for what you're getting is crazy. It's like the deal. It's the deal of the century. And so try at least the Super Greens and the Essential Source, and that's going to help increase circulation. Then when you start feeling a little better, if you're not willing to listen to me all the way, then take the next step. And the next step, change your diet. Eat more fruits and vegetables. If you're going to eat animal products, which I don't think you should, eat organic animal products. Increase your fiber. Have the bowels moving 2 to 3 times a day. If you have suspect of any type of neurological issue, back pain, neck pain, headaches, blurred vision, organ malfunction, come see us. Get it fixed. If you're not within our listening area, find a doctor in your area and get that checked. And you'll be amazed what happens. This is why I do a nutritional workup on all my patients. Because, like I said, we can give you the best chiropractic care in the world. You could be taking Dr. Joe's Super Greens and Dr. Joe's Essential Source. What I do for my patients is I do a complete workup, and I'll say, listen, I think you need this, 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 and this, and I'll lay out a plan for you. And every now and then a patient will say, well, doc, I don't have any extra money in my budget at this point. And I'll say, listen, once you change your diet, you're going to save so much money that essentially the supplements are going to be free. And they're like, well, I never thought of it that way before. And then if I sit down with them and I lay out a diet, well, what do you eat? Well, I eat this and it costs this much. Well, if you switch to this, it'll cost this much. For example, if you go out for lunch lunch is going to cost you what? $12, $15 with a tip and everything and tax. Let's say $10. What the heck? You're going cheap. You're going to do $10 for lunch. You can do really cheap, junky fast food. $10. You can get a can of chickpeas, cost about 89 cents, organic. I just bought them the other day at one of the big box stores. And then I add a little bit of tahini, which is sesame seed butter, lemon juice, olive oil, salt, and pepper. Put it in a food processor, whipped it up. I made hummus. Cost me probably $1.50. Got some organic celery, half a head, or whatever it is, a bunch. Organic was $1.39, so it cost you another 50 cents. So about, let's say, $3. Go out on a limb, really go high, $3 versus $10. You'll feel better. You'll have more energy. You'll work harder. You'll probably make more money because you're working harder, and the boss is going to recognize that. You're not going to fall asleep after work, after lunch. You're going to want to go home after work and go have fun, maybe go on a date. What a concept. Go out with your friends. Go maybe volunteer at your church group. Hang out with new people. Pick up a hobby because you're not exhausted at the end of the day. How many of you are exhausted at the end of the day? A ton of you are. And that's oftentimes self-induced. And when you eat bad foods, it cuts off the blood supply to the nerves, and the nerves malfunction. And so we got to bring the swelling down in your body, the inflammation down. Everything is affected by nutrition. You've got to think about that. You must have good nutrition to make good choices in life, for your brain to work. Now, like I said, I have a fracture at my low back, my fifth lumbar. It's called a spondylolisthesis. A lot of people have that. I see it a lot. And it's probably because I fell on my butt at some time real hard in my life. But when you fall like that, not only could you break a bone like I did, you can jam your whole spine up. And so often we're ignoring the fact that pain is it's a warning sign. It's telling you that something's wrong. A study based on practice-based observational model took a look at the effectiveness of intervention on a selected group of patients with both chronic and acute low back pain. It compared the effectiveness of chiropractic intervention with standard medical care in both types of low back pain. Patients were eligible if low back pain was their primary complaint. It was mechanical in origin, so it wasn't like a tumor or something along those lines, and were excluded if manipulation was contraindicated. Now, when would you not want to get chiropractic care, for example, or any type of care like that? If you have something called a dissecting aortic aneurysm, which goes back to what? Everything we're talking about. The bad diet lays cholesterol around the arteries become weaker and can balloon out. And when the arteries balloon out, it's called a dissecting aortic aneurysm. And if we measure it on x-rays and it's above 5 centimeters, our duty is to have you sit down, call the ambulance, and bring you to a vascular surgeon immediately because it's about to pop. How often do I see that? About 5 times a year in my practice. How often do I see them as big as 3 centimeters, 2 centimeters? Almost every day. And when I show it to people, unfortunately, their eyes light up. And they say, wow. And I said, now this can be causing a lot of your back pain. So if it's really, when it's 3 centimeters, we can still work with it. When it's near 5 centimeters, I don't even want to adjust you. It's so important that you get surgery at that point. And you know me, I'm not a big fan of surgery, but if it's going to pop, I want you having surgery. Because if the aorta bursts, you're dead. It's done. And so many times we do evaluations, we find things that we didn't expect to find. And if I'll have patients come in from all over the world, they'll come in for one visit and they won't come back again. I need to call them up and say, listen, I looked at your x-rays. There's things on the x-rays I don't like. You need to get to your doctor immediately and discuss this. Sometimes we find cancer. Sometimes we find fractures. Sometimes we find dissecting aortic aneurysms. So it's really important that you understand that if there's something going on, you may need other intervention. This study is showing chiropractic care is the most effective treatment for back pain by far. But there may be something else going on. So, folks, if you do want to come see us as a patient, we have offices in Marietta, Duluth, and Stockbridge. Go to my website, drjoeesposito.com, or just Google Dr. Joe, #1 Dr. Joe in the world, and you can make an appointment right online. Now, if you have questions, you can call the office. The numbers are right there on the website. And you can call the office. We'll answer all your questions about finances and insurance. Everybody's got those questions. Let's get real. And we'll get you an appointment as soon as possible. We can usually get you an appointment within 48 hours. So go to the website, make an appointment right now. Just do it. drjoeesposito.com, and we'll get you in as soon as possible. Then the next visit, we'll go over our findings. If we took x-rays, if we did exam studies, and we'll explain everything that we found. We're really good about explaining everything. And then we'll do a nutritional workup on you. We want to get you well. That's our plan. So neck pain, back pain, shoulder pain, headaches, car accidents, sports injuries, workers' comp injuries, go to my website right now. Our goal is get you well and keep you well. drjoeesposito.com. So today we're talking about low back pain and how it can be affected by your diet and how your diet can actually clog up your arteries, which can cut off the blood supply to the nerves, which prevents the nerves from getting oxygen, which causes the nerves to hurt. So you have to think, I have really bad neck pain or back pain or headaches. Is it worth having that double beef cheese hamburger? Is it worth it having those donuts like I was jokingly offered when I walked into the studio today by one of my colleagues? They all pick on me here. Is it worth it? And if the answer is yes, then do it. I'm being facetious, of course. If the answer is no, which I hope that's your answer, then you need to say, okay, what do I do instead? If you don't know what to eat, on my website, drjoeesposito.com, bottom right-hand corner, we have a link. You can type in your email address, and I'll send you a link to a lecture I did called So What Can I Eat? And actually, better yet, on my YouTube channel, I have a lecture called The 7 Deadly Sins of Nutrition. And you could listen to that. It's a link to my YouTube channel. You can go through my website or go right to YouTube. And there we talk about the food you shouldn't eat. Then I have the CD called So What Can I Eat? And there you can listen to what you should eat. It's not hard. It's easy, and it's really quick, and it's really effective and inexpensive. So we're talking about low back pain here, different treatments. Physicians in the study delivered a variety of treatment methods. Chiropractic physicians gave the care that included spinal manipulation, exercise plan, and self-care education. Medical physicians gave care that included prescription drugs, exercise plan, and self-care. Roughly 25% of the patients were referred to physical therapy by the medical physicians. There was an advantage in chiropractic care in chronic patients with pain radiating below the knee, chronic patients with no leg pain during the first 3 months of care. So basically what it's saying is the chiropractic worked extremely well. Those who received early intervention for acute low back pain at 3 years after initial injury reported fewer days of back pain than those who waited. So once again, this is another study that's saying don't wait. Start taking steps today. Cut out the bad foods. Cut back or cut out alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. When I say sugar, that's breads, cookies, cakes, donuts, pastas. Is it hard? Yeah. But I tell you, once you start doing it, give yourself 3 days. Commit to me. Make the commitment right now. 3 days, you're going to eat better. It's cheaper than anything you do right now. Like I said, you'll save so much money, it's ridiculous. You're going to save so much money and commit to me for 3 days. And after 3 days, say, can I do a fourth day? Yeah, I can. Because 3 days is usually what it takes to kind of reboot your brain. Start eating more fruits and vegetables. You got to eat raw food. Raw food has something in it called enzymes. Now, the reason you, a sack of chemicals, me, a sack of chemicals, is alive, or are alive if it's both of us, is because enzymes have interacted with these inorganic, lifeless chemicals and made us come alive. So the reason we're alive, from ashes and ashes, we become a living being because enzymes make that happen. Now, when you're little, your body produces a lot of enzymes, and that's why you're growing at an amazing rate. Everyone says that about kids, right? Oh, my gosh, look how much they've grown. Oh, you've gotten so big. The enzymes are making the body grow. They're flushing out waste products. The bowels are working. The bladders are working. And then life comes along, and we eat bad food, and we get stressed out. We have pinched nerves. In chiropractic, we call it subluxations. And you have pinched nerves, subluxations, and the body just starts to wear out. It's said you start dying the day you're born. And so enzymes need to be replaced. And you can only replace them from an external source from one place, and that would be raw food. As soon as you cook anything, whether it's a carrot or a steak or whatever, above 110 degrees, the enzymes start to break down. I cover a lot of this in my new book called Prescription for Extreme Health. It's covered very well. If you don't have that, you should get a copy, by the way. And my first book, Eating Right for the Health of It, is also a great book, too. And as the enzyme levels drop, we can increase those enzymes by eating raw food. Dr. Joe's Super Greens, Dr. Joe's Essential Source. Raw. Why do I make it raw? Costs a little more money for me to make it, but I'm giving you those enzymes. Eating broccoli, cucumbers, tomatoes, avocado, salad every day. The raw food is going to get those enzyme levels up, and you're going to be amazed how that fights inflammation, fights infection, helps the body regenerate, brain works better, vision clears up, hearing improves. So most of us are depleting our bodies in enzymes because we eat raw cooked food all day, every day. So the more raw food, the better. And that's going to help every function of your body, including pain. Because enzymes can actually get in there and start to help dissolve the plaque. In fact, there's a treatment called chelation therapy. I don't do that in my offices. It's done by a medical professional where they put in your arteries, they give you an IV, and they'll put something like EDTA in there or enzymes or high-dose vitamin C, and it can actually help dissolve some of the plaquing. And it's been shown to help a lot of things, even like cancer. So chelation therapy, chelate means to bind and take out. And it can bind to waste products or things like cholesterol or heavy metals and pull it out of your system. So there's a lot of things out there in healthcare that you're not aware of. And it's not about just getting insurance. It's about getting proper care. Regardless of whether you have insurance or not, this is your life. You got to take responsibility for it. So if you'd like to make an appointment, you can go to my website, drjoeesposito.com, or just Google Dr. Joe. We have offices in Marietta, Duluth, and Stockbridge. We try to see most of our new patients in Marietta. This way I get to meet you, and then we can continue care at any of the offices. So go to my website, make an appointment. Like I said, we accept most major medicals, car accidents, sports injuries. But regardless, so many people have ridiculous deductibles and copays. You have to take responsibility for your own health, and the cost is extremely affordable. And the changes you make in just your diet alone will probably offset the cost of the treatment and supplements and super greens and essential source and everything. So you'll probably, in the long run, make money on a deal. So go to my website, make the appointment right now for you, your friends, and your family, and your children. We want to get kids well as well. drjoeesposito.com, or you just Google Dr. Joe because we're the #1 Dr. Joe in the world. Hey, folks, thanks for listening. Tell your friends about the show. We'll talk to you next time. Friends about the show. We'll talk to you next time. Friends about the show. We'll talk to you next time. Friends about the show. We'll talk to you next time. Friends about the show. We'll talk to you next time. Friends about the show. We'll talk to you next time.